The doctor is in, and today it's pediatrician Dr. Courtney Sauls from Ascension St. John Pediatric and Adolescent Medicine. Today we're talking about that dreaded annual virus, not the flu or COVID, but RSV. Welcome, Dr. Sauls.
Thanks for having me.
So first of all, what is RSV and what makes it different from those other viruses like the cold or the flu?
Yeah, so RSV is an upper respiratory virus that our most vulnerable babies get in a much more intense way than older children or regular adults get. It's a virus that starts off in the upper respiratory tract, so in the nose and in the throat, and then it travels lower into the lower respiratory tract or the lungs, which is a little bit different than most regular viruses, and it specifically attacks our ability to clear out mucus. And so that can be really difficult for our littlest babies who are still developing how they're breathing and their immune systems are changing. And so it can be really stressful for babies to try and clear out their mucus.
So I hear a lot about RSV in kids. Can anybody get it?
Anyone can get RSV. We don't get very immune to it. It mutates and changes all the time, so we can certainly get it as older children, as an adult, but it really affects our littlest, most vulnerable babies the most, just because they're not very good at clearing out their own nose. They don't know how to blow their nose, and that mucus really builds up in their tiny bodies and is hard to get out. Can cause a lot of distress with breathing and sometimes low oxygen levels, and that's where we really get worried.
How contagious is it?
Very contagious, just like any other virus with all those cough and snot droplets, contact. And so that's where we always warn families if they're coughing around young babies to maybe stay at home, wear a mask, protect those littlest babies.
Don't go to daycare.
Exactly.
What are some of the treatment options out there that are available for a parent if their kid comes down with RSV?
Yeah, so we've done a lot of studies on what kind of things can we do to make these poor babies feel better, and really not a lot of things actually work. The best thing is going to be nasal saline squirt in the nose and then sucking those boogers out so babies can get it out of the body instead of draining down the backwards way. And also a humidifier, like a cool mist humidifier by the bedside, or running a hot steamy shower in the bathroom, making sure that your child is staying hydrated. If you have a young baby that's maybe breastfed or drinking formula, you want to talk to your pediatrician about the best hydration strategy for them. And that's pretty much it. If your child has a predisposition for asthma or wheezing, sometimes breathing treatments or albuterol may help, but rarely for most babies is that a good strategy.
Now, there have been some new developments in preventative treatments. What are some of those?
Yeah, so we've got a lot of new things coming down the pipeline for RSV. They've just developed a vaccine for older adults above 60 years of age. Older adults with chronic lung disease can benefit from having immunity against RSV and passing that along. But for little babies, we have a new medicine. It's an injection, not a vaccine. It is an injection of antibodies. So a vaccine makes our bodies make our own antibodies. But this injection, called Beyfortus is the brand name, just gives your body the antibodies itself, which is really cool. And it lasts for about 5 months period, protecting against severe RSV disease. The babies that qualify are any baby under 8 months of age, and then 9 months to 18 months, those that are most vulnerable with lung disease, asthma, or maybe born prematurely.
Awesome. Well, Dr. Sauls, thank you so much for being here. We appreciate your expertise on this.
Thank you.
Well, coming up in our next half hour, Stephen has an update on cooler days and rain.